I would tell any parent who is considering a course of action for their child's cancer treatment to take a good hard look at the people and the processes here at Children's Hospital of Philadelphia. There's a great team here.
When parents are considering picking up and coming to a new institution for a very important surgical oncology procedure, the reason to pick CHOP is because of the expertise that every member of the team brings to bear. As things go along in the patient's treatment, sometimes things come up, sometimes things have to change, and we're in such close communication as oncology and surgery teams that we're able to have the flexibility that each individual patient needs.
The working relationship between the members of our cancer team here at Children's Hospital of Philadelphia is fantastic. We all have a common goal in mind. We all are very dedicated to the concept of creating the best center that we can create to take care of these kids.
Everyone seems to appreciate the urgency and the need of collaboration, how important it is to do expeditiously and effectively. People are just willing to rearrange their schedules at a moment's notice to provide the best care.
The collaboration between surgeons here, compared to any place else that I've ever worked, is really the closest and the most comprehensive. It really kind of sets a model for me of how this should be done.
In many ways, the nurses are the glue that hold together the entire team. We lean on the nurses not just for the traditional role of caring for the emotional needs of the child, but also to help us to know exactly what is right for this particular child, for this particular family.
The families and patients that come here for their surgical procedures or who are CHOP patients and have surgery often look for me to educate them about what they can expect with surgery, as well as about their treatment protocol and any side effects. I usually defer to the surgeons to talk about the surgical approach, and often we will have the physical therapist, occupational therapist, and the medical team discuss with the family what to expect afterwards.
I think nurses are the front line, really, for surgical oncology patients, and having an experienced nurse at the bedside who knows what to look for, knows how to interpret the patient's issues and to support the family through a challenging time is really a very important part of the CHOP experience.
Well, each child is unique, and each child with cancer is unique. We believe in family-centered care at the Children's Hospital of Philadelphia. So for the child with cancer, all that expertise envelops the child and the family.
Nobody knows a child as well as their family members, and so just as we partner together with surgeons, oncologists, nurses, and all others who are involved in the patient's care, we include the families as part of the team, and I think that really brings about the best outcomes for the patients.